about health without the minister responsible for health. Minister Ali Pate, thank you very much for being here. Not too long ago, we were in Ghana together. And of course, as I said to you this morning, when it's a matter of health, which is a general matter for everybody, unless those who are dead, they are the ones that you are not worried about their health. We will continue to meet, and there's a lot that we have to do together. Ladies and gentlemen, all of you who are involved in matters pertaining to health, I welcome you to this very important occasion. It is an honor and a great privilege to stand before you today as chairman of this historic occasion, the official launch of the Care 365 Health Hub product. I am pleased not only because this initiative is timely and visionary, but because it speaks directly to the heart of one of our most critical national challenges: access to quality and affordable health care for all Nigerians. Health for all. When I reflect on the Nigeria we envisioned at independence, and even more so during my years of service in government, healthcare was never meant to be a luxury for the privileged or the urban elite. It was to be a fundamental right, accessible 365 days of the year to the child in Damaturu, the mother in Yenogwa, the farmer in Ogbomoso, and the teacher in Birnin Kebbi. This was what was envisaged for Nigeria. Yet, we know the truth. Millions of Nigerians still walk miles to reach a health post. Still, many die from preventable situations and conditions. And still more, many live in places where the nearest doctor is hours and on bad roads away. Care 365 is daring to change the story and the situation. And from the little that I have heard, and I won't understand, and I won't claim to be an expert, because one of the things that I worry about is this thing they call computer. When I see computer, I think it is sucking my brain, and I try to run away from it. When I came out of prison, computer, the laptop had come out, and they said to me, "You download." They got me a computer, put it on my table. And then I say, "How do you upload?" They say there's no upload, there's download. And anything that has no upload, only down, I don't really admire it. Now, but innovation is what we have here. This product is not just a technological solution. It is a social justice tool, a game changer, It is health security for all. A bold declaration that no matter who you are, where you live, or how much you earn, you deserve care and you will need care. Not just once in a while, not only when you can afford it, but every single day. And it must be made available and affordable. As I listen to the concept of the Care 365 Digital Health Hub, what struck me most is its simplicity, brilliance, and practicality. Simplicity, brilliance, and its practicality. A smart kiosk that serves a miniature hospital, that serves as a miniature hospital, equipped with diagnostic tools, artificial intelligence, and telemedicine connectivity. A system that enables patients from remote and rural areas to speak with professional and licensed doctors, to be diagnosed and treated. An affordable subscription model that even a roadside trader or mechanic can access. And trained community health workers empowered to offer first-line care in underserved areas. Those of us who come from villages, generally I'm not talking of you, are a product of a town or a city. We understand what I am talking when we talk of underserved areas, rural community. Some of us, our villages are not on the road. You will have a small handwritten sign, this way to, and then to where it is a village where you even cannot go there by road. Where that signboard is, you have to park your car and do the rest by trekking. But what we have here, what we are launching today, will take care of even rural communities that have that sign, this way to wherever it leads. It is no longer, or let us not make mistake. This is not a favor to the poor. It is our responsibility as leaders, as policymakers, as patriots, and as elite within our communities. It is no longer acceptable that in the age of artificial intelligence and space tourism, a Nigerian child should die of malaria because her mother couldn't afford to travel to the nearest health facility. It is unacceptable that young people in remote communities go blind, untreated, because there's no eye clinic for hundreds of miles. There are not just, or these are not just failures of infrastructure, they are failures of empathy and leadership at all levels. Care 365 reminds us that technology can and should be human, that innovation should uplift, not to isolate. Technology should be for inclusion and make health services available to all. Your Excellencies, ladies and gentlemen, I want to commend the visionaries behind this remarkable initiative, the developers, health professionals, partners, and investors who have chosen to innovate for humanity. You are the health heroes of today. But your journey does not end with this launch. It only just begins. The true test will be how quickly these hubs reach our IDP camps, our border communities, our remote rural areas, our riverine areas, and our inner cities. The true success will be measured not by apps downloaded or kiosks deployed, but by lives saved and dignity restored, by how much Nigerian life expectancy is enhanced. To the federal government, I urge, Minister, I urge you to fully integrate Care 365 into our primary health care and emergency system. To state governments, adopt and domesticate it. To donors and development partners, support it. To the private sector, invest in it, particularly the banks. And to the media, tell its story, herald it, and regularly report on its progress. Let us all become ambassadors of access, advocates of care, champions of dignity. We can all be our brothers and sisters keepers through participation and contribution to this hub. This morning I was saying to General Salami Abubakar that I pray that this will be a great success. If it is, it will only be second in terms of affecting our life generally to this. The effect of this on our life, no matter where you are in Nigeria today, is immense. And I believe that this Care 365 Health Hub system can be only second to the mobile telephone in our life. In conclusion, as a proud Nigerian and an incurable optimist, I believe this country will rise. But that rise must be inclusive. Not rise for some and download for others. It should be rise for everybody. But the rise must be inclusive, and inclusive progress begins with inclusive health. Health for all. Thank you for the honor of giving me this role, General, and all of you who are involved in this exercise. Thank you for believing in a healthier Nigeria and may God bless the Care 365 Health Hub. May it heal not just our bodies, but the heart of our nation, because the heart of our nation needs to be healed. Thank you, and God bless you all.
We are here. May I also proactively apologize if I have not mentioned your name. We are here today to celebrate and to acknowledge an innovation. We are here today to celebrate and acknowledge an innovation that started with an inspiration from God. I am a Nigerian, a proud Nigerian, and also an American. I live in America, I work in America, and I do everything in America. While in America, this vision and idea to innovate this product came to be. And through the help of God, I'm privileged to connect with His Excellency General Chief Olusegun Obasanjo. On his invitation to Washington, D.C. last year, he gave us the privilege to interact so he can enable this. It was through that we got a blessing to connect with our chairman, who is now my father. I adopted him, I'm calling my daddy, General Abdusalami Abubakar. From that very goal, the accomplishment and coming to fruition of this initiative became possible. His Excellency General Abdusalami Abubakar is the force behind this actualization. God have used him to make this come to fruition. He has championed this and provided everything we need to ensure we are here today. The reason for this vision is to make accessible healthcare, affordable healthcare, quality healthcare, and available healthcare available to the citizens of Nigeria. We are here to envision and to support the federal ministry, agencies, and businesses to be able to provide adequate care for every citizen. Because care for citizens matter a lot. The idea for this care is to provide, through technology, an accessible point where, through, as we do in the West, in America, in Canada, in UK, people can from their kitchen, their office, access healthcare. And this is what we're about. Through this, we developed a system that connects through application. You're able to download this on your phone. And through your phone, you're able to access and connect with our doctors in America, in Europe, in Asia, and in Nigeria to discuss your healthcare needs. From that application is connected to our mobile kiosk, which is here, we'll be unveiling. The mobile kiosk is able to check for your vitals, your invasives and non-invasive tests. And all of that stuff connect also with the application that doctors can discuss with you on the spot to assess and do clinical examination so you can be able to get quality health care. From that point, we're able to connect with our mobile clinic that has bed and has everything in it to be placed in rural areas, in semi-urban areas, in urban areas, and everywhere so that we can help to bring care closer to the people. It is for this reason that we feel that Care 365 matters. This is the first ecosystem that in one single source of truth is connecting providers abroad, providers locally, connecting the mobile clinic, connecting the kiosk, and connecting with providers everywhere. Therefore, we consider this a privilege to be here today, to be given this platform to showcase what we are about. The Federal Minister of Health himself, Coordinating Minister of Health, we do the unveiling, and at that point, more details about this innovation will be explained to us. We consider this today a great privilege to be here, to be able to showcase this, and it's a privilege to be hosting the presidents, former presidents, and the leaders of this ecosystem. We say thank you, and may the Lord bless you, and bless Federal Republic of Nigeria. Thank you.
How I became the chairman of this Care 365. I came back from a medical excursion. My staff told me President Obasanjo has phoned me, is looking for me. and my Oga was in America. You know, General Obasanjo is not somebody who stays 24 hours in this country. He is always galloping from one country to the other. So I called him back. He said, General, I have got an assignment for you. I said, you know, your order is a command. So what can I do for you, sir? He said, there is a young man who is an engineer who lives in America but has turned towards his attention towards medical care. He wanted me to be the chairman of that Care 365. He said, General, you know my plate is full. So I ask you to take over as the chairman of this occasion, of this organization. So I said, sir, you know I'm not too well. He said, shut up. So that's how I became the chairman of this organization. Well, Mr. President, thank you for roping me in. I want to thank you, and I'm glad to be the chairman of this Care 365. To Engineer Ngozi and the founders of this Care 365, I want to thank you for giving me the opportunity to chair this laudable company, so to speak. Your Excellencies, ladies and gentlemen, in my capacity as a soldier, I have traveled up and down this country. I have served from the north to south, from east to west. And during my tenure as the head of state, I also traveled a lot in the country. And one of the things that really attracts my attention is our medical care. As the chairman of this occasion has said, there is no facility all over the country to access medical care. So this Care 365, working together with the Ministry of Health and the state governments, will provide an answer to this problem. To the Minister of Health, I again want to thank you for finding time to come and unveil this Care 365. Now, as the chairman of the occasion said, launching this thing is not the end of the problem. It's the beginning of the problems. It needs support from all of us in the way we can assist to deliver health care in this country. In his speech, Mr. Ngozi has alluded to the fact that God has gifted Nigeria with the current Minister of Health. I think since he has taken over, a lot has been done to change the delivery care, health delivery care in this country. Your Excellency, Honorable Minister, I want to thank you for what you are doing. To all of us, as I was saying, we need to support Care 365 in order to deliver health care in this country. I want to thank all of you for coming and to listen and to unveil Care 365. As I said earlier, it needs all our support. So please support this Care 365 without any chooks. Thank you very much for coming. Chairman of the occasion, I want to thank you. I know you are going to Algiers today, but since you roped me into this, that's why I brought you here, despite the fact that you are traveling. And I want to thank you. You heard him saying, I'm his Oga, and you know he is joking. He is our Oga. So our Oga, thank you very much for coming, and I want to thank everybody for coming. I forgot to recognize an individual who has been up and doing, and that is Dr. Amina Sani Bello, whom I roped also to be a member of the board of this Care 365. Dr. Amina, I want to thank you for all that you are doing and you will continue to do. Dr. Amina is my daughter, so I have asked her to join this Care 365. So most of the job she will do is on my orders. So Amina, please carry on with the Care 365 and do all the best you can to assist this organization. Thank you very much. I have seen another boss whom I didn't see before. That is Payam, I.S. Payam. Thank you very much for coming. God bless Nigeria, and may health care continue to grow from strength to strength. I thank you very much for this.
A great honor and with a deep sense of duty that I stand here with you at the official commissioning of the Care 365 Health Hub product. This is bold, this is timely, and much needed innovation. I want to thank Dr. Ungozi, Engineer Ungozi, the founder of Care 365 Health Hub, all the members of the board of Care 365 who have brought us here for this really important step that is trying to make our healthcare system more accessible, more affordable, more efficient, and more people-centered. And I also would like to commend Your Excellency, the chairman of the Care 365 board. Janab Salame Abubakar, thank you for your leadership of this effort, for your persistence, as well as His Excellency President Olusegun Obasanjo for also making the connection. Then the presence of three of you signals to all of us an important message that our duty to our country extends beyond when you are physically, let's say, in an office. You've continued to serve in various ways, tirelessly, in all ramifications to see that this country continues to develop. So I'd like to thank you for this and for many other things that all of Your Excellencies, former heads of states, presidents that are here with us. I think this innovation is coming at a time when technology overall is reshaping how we live, work, and access services, from telephones, mobile telephony we've heard, with digital technology, seeing advancements in healthcare. This hub that we are going to launch today represents a very practical, innovative solution to one of our most persistent challenges, ensuring that quality health services are available and affordable to all Nigerians, especially those in underserved and remote communities, such as mine in remote part of Bauchi. And through what we will see through the kiosk, I think you will all understand the import of this innovation in terms of what it will do for poor women, children, displaced populations, marginalized populations, by making it possible for them to access healthcare. It is an opportunity for our healthcare system to leapfrog, and it fits squarely within the context of what this administration is trying to do. The transformation of Nigeria's health system is underway. Under the leadership of His Excellency President Ahmed Tinubu, we had a 4-pillar strategy, one of which is governance, to ensure that we orient our health system to serve our people, to work with states, federal government, local governments, civil society, private sector, to orient our system to serve the needs of our population, and to ensure that no one is left behind, to regulate it such that the public mission is protected, but to have data and also be transparent and accountable to our population. The second pillar is to improve the health outcomes by expanding primary health care. On the supply side, this CARES 365 Hub is an important contribution in that direction, but also to make it affordable by ensuring that there's a payer. The health insurance is being expanded to ensure that affordability is also taken into account, and referral system to higher levels of care. The third pillar is to unlock the healthcare value chain. There is a value chain, and it's no surprise that there are many private sector actors, Zenith Bank and many others who are here. There is economic value in health, because health is an investment. It provides services, but it can create jobs. And in healthcare innovation, there are opportunities to create hundreds of thousands of jobs in just managing this, not only in directly providing the care. And fourthly, to ensure health security, because if we have these technologies, we saw during COVID, it was not even possible to visit health facilities. Digital technologies provide the avenue for schools to operate, and healthcare can function if you have platforms like this. But the cross-cutting effort, the cross-cutting enabler of all of these pillars is digital transformation, allowing us to organize, use technology to leapfrog. And so I thank the proponents of this for really bringing it to fruition as a good exemplar of how we can leapfrog our health system to ensure that our people are served. I would like to thank everyone who is here, and with that, I have been asked to formally commission, and I hereby commission this CARE 365 Health Hub to the benefit of all Nigerians and for the glory of God. I thank you very much for giving me the honor of commissioning it. Thank you, Your Excellency.
Your Excellency, you are also expected
to be part of this important occasion. 7.5 years ago, I joined NAFDAC from diaspora, and I cannot be prouder for Ngozi for thinking about home. God took us out to bring us back. Ngozi, I'm very, very proud of you. In terms of technology and deliverance of healthcare, as soon as I got to NAFDAC, I knew we have to go digital. About 70% of our processes are digitalized. First, it brings transparency, it brings efficiency, and it links us to the rest of the world. This mobile medical device, we are going to register in NAFDAC. But there are two things that I got from the occasion. First, local manufacturing. To hear that this will be manufactured in Nigeria makes my day, because we have to think of a local content with regards to healthcare delivery. there's going to be e-prescription. We have what is called the Green Book. It is downloadable, and it has at least 7,000 products that we have approved. So that Green Book will also be linked with this device. The Green Book is similar to the Orange Book. When I was in the US, there's the Orange Book of US FDA. As soon as I got to NAFDAC, I said, we need a Green Book. And it has about 7,000, 8,000 approved products right now. So that Green Book will be linked to this. If a doctor is making prescription, that doctor must go through the Green Book. It will assure the doctor that this is approved drug product certified by NAFDAC. We also have what is called the track and trace technology. We use track and trace to monitor millions of doses of COVID-19 vaccine during the pandemic. We are using it, actually we have used it for narcotics because of abuse of narcotics in our country. We are using it now for MNCH products, maternal, newborn, child health commodities, to make sure that the products that we have approved have not been falsified. Along with that, we have scan to verify. It's downloadable, scan the number 2, and then verify. So that any product that has gone through our track and trace or traceability information system can be verified using the Scan to Verify app. So without technology, as a regulatory agency, we cannot move from where we are right now, maturity level 3, we cannot move to 4. So we do not have a choice. Because the WHO that is auditing us, that is doing global benchmarking, expects a strong regulatory agency to be digitized, to use digital tools. We have used also Med Safety app, and I'm going to talk with Ngozi again. Med Safety app is an app that we use to record adverse drug reactions. We have trained over 20,000 healthcare workers during the pandemic on how to use Med Safety app. By recording what side effects patients are undergoing or going through, it helps us as an agency, the pharmacovigilance is domiciled in NAFDAC. It helps to record and transport to base or vigilize at WHO. So we're using different tools to ensure that there is a holistic approach to making sure that effective healthcare delivery is done for all Nigerians. Thank you very much.
Initiatives like the Care 365 are not outliers, they are allies. This platform speaks directly to our goals to strengthen primary health care, expand access to underserved populations, reduce health inequalities, and generate economic value through jobs and local content. What we must be witnessing here and what we are witnessing here is not an experiment. It is a tested solution built by Nigerians with global expertise for Nigerians. Let me take a moment to celebrate the quiet force behind this ecosystem. General Abdusalami Abubakar. Sir, your steady guidance and belief in Nigeria's capacity to build, heal, and innovate continue to inspire hope, and we salute you. To the private sector, I say this is your moment. The government cannot do it alone. We welcome more innovations that align with our national vision. Let your ideas be disruptive, let them be local, but above all, let them be solution-driven. I also issue a clarion call to our state governments, Partner with Care 365. Let this technology find roots in your primary healthcare centers, your rural communities, your hard-to-reach populations. This is not a time for hesitation. It is a time for collaboration. To our development partners, align your support with platforms like this. Provide the financial and technical muscle to scale this breakthrough across our regions. To regulatory institutions and medical bodies, walk side by side with innovation. Let us make integration seamless, oversight efficient, and policies enabling. And to our young people, the health students here, our developers, engineers, dreamers, look at why your compatriots have built and look at what they have built for our nation. Nigeria is not waiting for saviors from abroad. Nigeria is building its future from within. As we stand at the edge of this healthcare renaissance, I want to assure you that the federal government remains unshaken in its support for indigenous innovations that solve real problems, not just in health, but in education, agriculture, finance, and security. Care 365 is the kind of dream we will continue to fund, promote, and protect. So today, with pride in my heart, I congratulate Silicon Hub, the entire Care 365 team, and all stakeholders on this historic milestone. I have no doubt that this platform will be a benchmark for healthcare innovation, not only in Nigeria, but across Africa. And with that, I am honored to declare the Care 365 Health Hub officially launched. Thank you, and may God bless the Federal Republic of Nigeria.
In the 80s, 90s, if you go for conferences in agriculture, they will talk about NPK fertilizers, they talk about grafting, they talk about crossbreeding to create hybrids and so on. Today, when you attend any international conference on agriculture, more than 60% of the discussion is on deployment of the digital technology. So I'm so happy with the CEO of Care 365, the young man. I have to thank you very sincerely for bringing this innovation to our country to solve our health problems. We have so much about the relevance of this. And even for those who have the money to go anywhere in the country for medical care, sometimes you have a lot of problems going to the right place very quickly. I remember in 2007 when I was the governor of Bayelsa State and also a vice presidential candidate of the PDP then, my chief judge then took ill. And just we couldn't know the problem. We have to send through air ambulance, took him to Cromwell Hospital in London, which is one of the best hospitals in Europe. Cromwell Hospital kept him for some time, got all their consultants from within Europe, and got back to us that they can't know exactly what was happening to the man. And they predicted when he will even die. But they said that the problem will be tropical. So they will recommend hospitals that know more about tropical diseases. And they recommended one hospital in Cape Town in South Africa. So we have to fly him from Cromwell Hospital, London, to Cape Town in Africa. In fact, when I visited and I asked the consultant managing him, I said, what is the problem? The person said, they can't say what they have only detected is strange protein in his body. Strange protein. They kept him longer than the date the Cromwell Hospital predicted he was going to die, but he still died in South Africa. If we had a product like this, I don't think we would have been going up and down. I think one of the things that CARES 365 will help is to direct us to the appropriate hospital that you will manage yourself for even those who have the money to go abroad. And of course, from all the discussions, it will help the management of health generally. I have to thank the MD of NDDC, my younger brother, Dr. Sam Ogbuku, that already you have the system and you are partnering with them. Zenith Bank, thank you too, because you are one of the partners. I saw it on that page. It's about 13 partners. Let me also commend these 13 partners for encouraging this digital revolution in the health sector. And that is the way to go. Once again, let me join my boss to thank all of you for coming. I thank you all.